let's get started. And if people trickle in, hopefully they do so quickly before the webinar is over. All right, so you are in the measles microlearn. I do apologize because I did change the date and some reason it is back to the original date. But today is February 2nd. We did reschedule from last Monday when we've got tons of snow. So I hope everyone is staying nice and warm and out of the snow. And I hope that we don't get any more, even though I think that the woodchuck, the groundhog, said that we are going to have 6 more weeks of winter today. So if you believe in that, unfortunately, 6 more weeks. Anyways, my name is Allie. I am an infection prevention training liaison at the Rhode Island Department of Health and Project Firstline. I'm also a public health nurse consultant for the Center for Acute Infectious Disease, and I will be presenting the microlearn today for measles. I did mention this before, but in case anyone has come on since then, we are offering a certificate of training for today's session, as well as continuing education for dental IPC requirement and EMS. So to receive either one of those, please make sure you fill out the pre-session survey that Abby put in the chat. Also, make sure you complete the post-session survey that will be emailed to you tomorrow. There are no CNE credits. It's just too short of a course for this course, as well as the other microlearns that we're offering in this series. This is one of 5 for this series, but you don't have to attend all of them. You can attend them as you please. And that, I think, is all of the quick announcements about CNEs. I do want to point out that we do have 2 separate webinars today. So this measles microlearn, which runs about 15 minutes, and then we have a respiratory virus season guidance updates for healthcare workers at 12:30. I will be presenting that as well. It will be about 30 minutes, and I will have Abby put that link in the chat if you would like to register and haven't done so yet. Again, we'll log off. There'll be a separate link, and then 12:30 we'll start a new webinar, and it's titled Respiratory Virus Season Guidance Updates for Healthcare Workers, all about RIDO's recommended return to work guidance for all respiratory viruses during respiratory season. A little bit of a mouthful. All right, so let's get started. So if you haven't attended a microlearn before, today's session is presented in a dual microlearn train the trainer format. Before presenting a microlearn, you want to check with the policies and protocols at your facility and adapt the content to that accordingly. Incorporate microlearns into existing opportunities where groups of healthcare workers gather together. This could be like a pre-shift huddle or a team meeting, something where smaller groups gather. You can have a short conversation with some feedback, maybe some new education, but hopefully everything that they know that you're just kind of reviewing. Sessions should be led or facilitated by an experienced team member with infection control experience. And the microlearns reinforce infection control concepts when risks are observed in patients or in the patient environment, not necessarily in visitors or other staff members. So today we have welcome and introductions. Then we will go over our learning objectives, have a measles overview, how to identify measles, what should healthcare workers do if they suspect measles, and end of session feedback. If you are looking for a longer measles course, Dr. Kearney, our medical consultant, who is actually on the webinar today in support, will be doing a measles for healthcare staff, healthcare workers, I think is the title, in March. So keep an eye out for that if you are interested. All right, learning objectives today will be to understand the infection control challenges with measles, know how to identify measles, appropriately respond if you suspect measles, apply your knowledge to your facility policies, PPE, and job safety, and then feel confident in delivering a microlearn material to colleagues if that is something that you intend to do after attending this webinar. So the Project Firstline Infection Control microlearns are a series of guided infection control discussions that provide brief, on-the-job educational opportunities. Each microlearn focuses on a single infection control topic and connects infection control concepts to immediate practical value. Healthcare workers can easily apply the key points to their daily work and perform the recommended actions to keep germs from spreading. The discussion guides used to create this presentation and lead your microlearn are here before you and available on CDC as well as cited in the references of this presentation. I also do believe Abby will put the link to these microlearn discussion guides in the chat. So our first part of the microlearn when teaching is all about a quick guide to what measles is. So measles is one of the most contagious infectious diseases and can lead to severe illness and even death. This is why it's important for everyone in the healthcare facility to be prepared to quickly recognize possible measles and take action to prevent spread in their facility. The best way to protect healthcare workers from measles is to ensure that they are up to date on the MMR vaccines. MMR vaccinations is measles, mumps, rubella vaccinations. Measles is a respiratory virus, and measles virus lives in the nose and throat of infected people, and it can spread to others through the air, remaining infectious in the air for up to 2 hours after an infected person leaves the area. So as a facilitator of a microlearn training at your facility, now would be a good time to discuss what your facility does to prevent measles from spreading. So let's put that into practice and take a quick moment and do that together now. So if you wouldn't mind sharing in the comments what type of facility you work at, whether it be long-term care, acute care, outpatient, public health, and what it is you do at your facility to prevent the spread of measles. If anything, triage screening and acute care, isolate child at home, with school nurse. Oh, we have a lot of different settings. That's exciting today. Elementary schools, long-term care, primary care, acute care. This is great. Okay. So isolate, send them home, universal precautions, triage screenings. That's all things that we can do within our facility to help the spread of measles, help prevent the spread of measles, not help it spread. Thank you all. All right. So early symptoms can seem like a common cold, but almost always include fever with one or all of the 3 C's, which is cough, runny nose, also known as coryza, and red watery eyes, also known as conjunctivitis. So cough, coryza, conjunctivitis, the 3 C's, and or can also include tiny white spots in the mouth known as Koplik spots. A rash generally occurs 3 to 5 days after symptoms begin and usually appears on the face and behind the ears first, and then spreads down the body. The rash is described as a maculopapular rash, which means it has flat, discolored spots mixed with small raised bumps. Patients are considered to be contagious from 4 days before to 4 days after the rash appears. So here in front of you, you can see first day of the rash, you might have Koplik spots, some small spots. Third day of the rash, you'll see more spots, confluent maculopapules, and some discrete maculopapules where they're almost like starting, because you're starting at the head and you're kind of going down. And then you have a picture of a mouth, if this is hard to tell what this is. And you can see little like red and white spots, also known as Koplik spots. So it is important to remember when recognizing a rash that rashes appear differently on different skin tones. In most textbooks, photos from classical teaching, we see how rashes appear on white skin. However, we care for patients with many different skin types and tones. So here we have pictured a measles rash occurring on different sites and different skin tones. And you can see it appears different on each child. So again, the rash usually starts on the face and behind the ears, and then travels down the trunk and can look different at different stages of the illness. So after discussing with your staff what measles is, you will go ahead and review how to identify measles in a healthcare setting. So assume a patient has measles if they have measles symptoms, which we just went over, and have at least one of the following. They've spent time in an area in the US with a known measles outbreak. They've recently been around someone with measles. They've traveled internationally in the last 21 days. And they have not been vaccinated for measles, or they don't know their vaccination status. If your facility is located in an area where measles is known to be spreading, anyone with measles symptoms should be considered to have measles until you rule it out. So as a facilitator in your facility, here you could discuss how your facility is taking extra precautions during outbreaks and the process for informing your facility's infection control team and or local state health department. So I'm not going to go ahead and have you do that in the chat like we did last time, but it is important to be able to contact your health department. And I will have Abby put that phone number in the chat here. You would call the Center for Acute Infectious Disease and Epidemiology and ask to speak with a nurse who handles measles. And there we can approve testing or talk you through whatever you need. The phone number for that is 401-222, I want to say it wrong, 2577. There we go. And Abby put that in the chat there. All right. So now we will discuss an action plan. If you suspect measles in a patient, what do you do? Reduce the risk of spread, also known as infection control, by quickly identifying and isolating patients with known or suspected measles. This is key. Assess, test, and manage patients in an airborne infection isolation room. But if that isn't possible, select a private room with a door that shuts and doesn't vent air into the facility. So I did see we have some school nurses on here. That would be very tricky in a school. So again, you would take that second recommendation where you would select a private room with a door that shuts. Properly using a fit, tested N95 or high-level respirator before room entry, even if you are vaccinated. 2 doses of the measles, mumps, rubella vaccine protects people about 97% of the time. But the chances of vaccinated people getting measles are very small and not zero. So you still want to take precautions. Recommending that patients wear a mask until appropriately isolated in an airborne infection room. Limiting transport or movement of such patients outside the room unless medically necessary. And also continuing to follow standard precautions. So that will include cleaning your hands before and after caring for the patient and after handling items or touching surfaces in the patient's room. It would also include adhering to your facility's routine practices to clean and disinfect surfaces and handle linen, and using additional personal protective equipment for specific tasks like blood draws, for example. As a facilitator who is giving this presentation, here is where you would want to discuss where this would happen in your facility and the location of the airborne infection isolation room. Additional steps to take include notifying local or state public health departments about a suspected measles case, which we slightly went over. I'll have Abby put the phone number in the chat again. 401-222-2577 is the Center for Acute Infectious Disease Epidemiology. You would call them if you're in the state of Rhode Island. Collecting samples for testing as directed by local or state health departments, and managing patients with supportive care. All right, so here we have a poster, how to reduce the risk and spread if you suspect measles. This does go along with the learning guides that CDC made as well. I will have Abby also put that in the chat. We're putting Abby to work today. And you can hang this, you can use it as a reference, you can hand it out if you are doing your training in a setting where it's appropriate to hand out some flyers or give to staff so that they can look at it later. And the last part of the microlearn is just about reinforcing the concepts we reviewed. So it is important to know and teach that every healthcare worker has a role to play in rapidly recognizing measles to prevent its spread in healthcare settings. You want to identify barriers, if any, in your facility, answer questions staff may have about measles, and then provide continued learning resources. And we have a few here in front of you: clinical overview of measles, measles infection control guidance, public health notification contact list, and I also included the Rhino measles algorithm, which guides providers for who would be eligible for testing. But also you can always call Rhino. Here, as a facilitator, you can also connect content with facility-specific information relevant to your team and share follow-up opportunities. So here are today's takeaways from our measles microlearn. Measles is highly contagious airborne disease. Symptoms include fever, red watery eyes, runny nose, cough, spots in the back of the throat, and rash. Immediately identify and isolate a patient that you suspect to have measles. Inform healthcare team and appropriate personnel, and take infection control actions to prevent the spread. And these are our references for today's session, as well as a few that we've put in the chat. We do have an end of session feedback. It's a quick 3-question poll, if you don't mind filling that out. This will help us to improve future training to help suit your learning needs. Also, quick reminder that this is not the post-session survey that will be emailed to you tomorrow in order to receive your certificate of training. As this is a quick microlearn style webinar, we did not reserve time for any questions. However, if you do have questions or are wondering how to proceed with your own microlearn presentations in your facility, in your huddles with staff, please feel free to reach out to our Project Firstline team directly, and we would be so happy to assist you and provide you with whatever you need. As long as you have finished your end of session feedback, you are all set. And if you signed up for the 12:30 webinar, I will see you there in about 15 minutes. Thank you.